Hi, I'm Hannah. I'm gonna be your nurse today. And it looks like you're actually getting discharged. Can I get your name and date of birth?
Yeah, my name is Megan Kostreba and my date of birth is 6201.
Perfect. And who do you have with you?
I have my aunt here. Her name is Clara.
Yeah, I'll be staying with Megan and helping her for the foreseeable future until she gets, I understand that she's got a pretty, like a diagnosis that's going to be something that she's dealing with forever. So I just moved in with her to help her.
Oh, awesome. And that's gonna be a long-term thing.
Yeah.
Okay. That's actually one of the things I wanted to cover with Megan, so that's perfect. Megan, do you So there, I just have a few questions. I have your discharge paperwork with me, but I just have a few questions I wanted to ask you. Um, do you have access, or who does the cooking at your house?
Mostly it's me usually.
Okay.
Mhm.
Yeah.
I really like to cook
And
too, so I can help a lot with like making meals and stuff for Megan if I'm not going to be around too.
okay, and are you aware of the sodium restriction that Megan will have?
Yeah, so that's like on the nutrition label. It's usually on the nutrition label, right? So I can just look at
Yeah.
packages. Okay.
Yeah, so she has a restriction of 2,000 milligrams of sodium or less per day. And we have that in there so that her body retains less fluid. Um, and so some things that she may want to avoid are like a lot of packaged foods, and like cheese has a lot of sodium in it, stuff like that. All
Okay,
right.
sounds good. We have some pretty yummy spice blends that don't have any salt in them, so we'll give those a try.
Oh, that's beautiful. Um, and I also have some information on your medications. Um, Megan, do you have any questions on your medications?
Um, no, I feel like you went over them pretty good. Could you just give me like a rundown of them one more time? Of
Yeah,
when I
so
need
you will be on an aspirin, a daily aspirin, just a baby aspirin. That's gonna help keep your blood a little bit thin, so we can prevent any further heart attacks or anything like that. And then you're on a carvedilol or Coreg. That's for your blood pressure. You're on lisinopril, which is another one for your blood pressure. Um, and then ezetimibe, which is for your cholesterol, and hydralazine you are on, which is again for your blood pressure. And then torsemide is going to be that is going to help you get rid of that fluid. So that's going to make you pee a lot. Again, like a lot of these meds are going to might make you feel lightheaded. So make sure to transition slowly and just take your blood pressure and heart rate beforehand,
Okay.
with that home cuff that we're sending you with. Um, and if it's, I have restrictions on your paperwork, and if it's under those numbers, then you actually, you'll contact your primary care provider and hold those medications. You
Okay.
are also on potassium chloride. That is to help um, your potassium levels stay at an adequate level. And then you're on warfarin, which is your blood thinner. And that's because of your atrial fibrillation. And then you are on glyburide for your diabetes, your blood sugar
Okay.
management.
Okay.
Hannah, I had a question. Is there any other foods that we should be avoiding? Like if does she need to eat low fat, or can we have steak and stuff like that?
So you obviously want to be eating a heart healthy diet, Megan, because of your heart history. So this is diet consisting of lots of vegetables, lots of fruits, nuts, seeds, beans, lean proteins, foods like that.
Okay.
Yeah, and then another thing I wanted to talk to you about is your fluid restriction, Megan. Um, because of your history of heart failure, you won't be able to consume as much water as you want or fluids as you want. So you need to keep your fluids at I think it's 2,000 milliliters a day. And this is just to help, keep that fluid off and so you're not retaining it. And then I did want to go over some other some symptoms that you would need to seek medical attention for. So one thing I wanted to start with was just weight gain. It is very important for you to weigh yourself daily. And then if you are having any weight gain of 2 pounds in a day or 5 pounds in a week, you would want to call your doctor and be seen immediately. If you have any worsening shortness of breath or worsening edema in your lower extremities, you would want to be seen as well. And then if you find yourself having to sleep upright in a recliner with like many pillows at night, then you would also want to be seen. Since you are on a blood thinner, also if you have any like head injury, you'll want to be seen. And that's just to make sure you don't have any bleeding in your brain. And then with your atrial fibrillation, if you have any like palpitations or like fast heartbeat, or irregular heartbeat, you would want to be seeing chest pain, obviously, and then muscle weakness or cramping. These can be signs of low potassium levels. And so we just want to, which can be dangerous and can cause dangerous heart rhythm. So if you have any muscle weakness or cramping or numbness or tingling in your extremities, we would want you to be seen immediately.
Okay. So should I also be eating more potassium then if I'm taking potassium?
Yeah, that's not a bad idea. There's a list of potassium rich foods on your discharge plan as well.
Okay.
Your torsemide, one of your medications that you're on, it can sometimes cause people to be low on potassium.
Okay.
So yeah, potassium rich foods would be great.
Okay.
And then I've put all your future doctor appointments along with their numbers and their like visits, like where the clinics are and everything on your discharge paperwork, as you will have a few follow-up appointments to get to.
Okay.
Oh, awesome. That's really good. So all those follow-up appointments are already on her discharge paperwork. That's
Yes,
helpful.
and I've actually highlighted the details of them for you.
Perfect.
Thank you.
Yeah,
Mhm.
I just had one quick question. So Megan and I really like Taco Tuesday, and we go to the local taqueria, and we really like to sometimes have, a margarita or two. If like, is there any way that we can do stuff like that? Like, can she like take more of her water pill or something like that? I don't know. I don't want to like have our quality of life, so low that we don't get to go out and have fun and stuff. What do you think about that?
Yeah, so obviously margaritas and tacos are gonna have some excess sodium in them, and so that will cause Megan to maybe retain some of that fluid. So she may need to take extra of her torsemide. I think that is something that she could discuss with her primary care provider
Okay.
at her next visit too. Yeah, because everyone loves a good taco.
All right.
And then do you understand what is happening with your heart when we say you have heart failure?
Kind of. All I know is that like my heart's failing on me. But
Yeah, so because of your probably a few things, your hypertension, your high blood pressure, your atrial fibrillation, and your past history of heart attack, your heart has some damage to it. And so, which means it's not pumping as efficiently as it once did. And
Okay.
because it's not pumping very efficiently, it's not like blood is not being pumped to the rest of your body. And instead it pools up within your heart and your lungs and your body, which causes edema, and it causes your shortness of breath.
Oh,
And
okay.
yep, and so that's why the changes to your diet and your fluid restriction and like your medications will hopefully control this and manage this so that you're not hospitalized in the near future for this again.
Okay. Yeah, okay.
And then yeah, I guess, do you have any questions? or
I
anything?
don't have any other questions.
Yeah,
Um,
thanks.
Clara, do you have any questions? No?
No, I think that, yeah, we have all the phone numbers that we can call if we do end up having questions. So that's good.
Okay, perfect. Well, here's that paperwork for you. We'll get you discharged in no time.
Okay, well, thank you so much.